Good evening, ladies and gentlemen. Welcome to the Pitt County Board of Health meeting for May. At this time, I'd like to call the meeting to order. First item on our agenda, minutes from the April meeting. In your packet, there's two sets of agenda or meeting minutes. One was for a closed session, one for open. At this time, there's no comments. I'd like a motion to approve the minutes. That's both of these minutes.
So moved.
Second.
I have a motion to approve and a second. Any discussions? All in favor?
Aye.
Aye.
Opposed? Motion passed. Second item on our agenda, physical report.
Thank you,
Ready?
Mr. Chairman.
Thank you.
You have the April 30th financial report in your packet. I'll go over the highlights. The budget, current budget is $9.67 million. 10/12 of that, or the pro rata budget, is a little over $8 million. As of April 30th, we have actually received $7.4 million in revenue from various sources. We have incurred expenditures of about $7.2 million, giving us a surplus at April 30th of about a little over $2 million, $200,000, in fact, $206,000. Once we take in the timing items, those timing items actually reduce the revenue by $104,000. So that takes that surplus down from $206,000 to about $103,000. And I'll go over some of the key points in that. As we go over the revenue lines, you see our Medicaid revenue, we've brought in about $723,000. That's significantly below budget. We have seen that trend all year. Number of reasons for that trend. We have a shortage of, and we're currently recruiting for 2 nurses in the health department. We've had those vacancies for a good part of the year. We also had 2 nursing positions that were eliminated early in the year, and they through early retirements. And those nursing positions were frontline nurses, so it was probably a little bit of poor budgeting on my part in that I did not take into account the effect of losing those frontline nursing positions would have on our Medicaid revenue. So part of that, if you have to point that arrow at anywhere, I think you have to point it at me. Another reason for that is we have 2 programs, pregnancy care management and care coordination for children, where this is the first year we are, for the entire year, we're funded on a per member per month reimbursement scheme. So they look at the Medicaid population in the county and they give us a per member per month fee for that. Now, if we contrast that with prior years, we actually did a fee for service, a reimbursement scheme on those programs, and I did an analysis recently. The fee per service revenue, as you can suspect, was greater than the per member per month revenue we got on the same volume of work. So that's had a detrimental effect on our Medicaid revenue also. Some good news is we did get notice of our Medicaid cost settlement. As the budget shows, we have budgeted $387,000 for Medicaid cost settlement. We actually are going to get about $487,000, so about $100,000 to the good on that. And you'll see in the timing column under Medicaid cost study, I put $405,000. That's really 10/12 of the $487,000. I'm trying to kind of match it up with where we are in the budget year. Clinic fees, environmental health fees are still trailing the budget. We're making up some ground on both of those here recently, and primarily on environmental health fees. The DHS Diener, that's just a reimbursement of cost. County funding, they have, at April 1, they transferred the entire amount, fourth quarter amount, so I've kind of backed out 2 months to get that timed up with our expenditures. So all in all, we're about where I thought we would be at this time. It's certainly good news that we did get that $100,000 more Medicaid cost settlement than we anticipated. There is one caveat with that is we haven't gotten that money yet. They've given us notice that it's on the way, or it's what the settlement is, but we haven't got it yet. Typically, we get that very late in the fiscal year. So keep your fingers crossed. I hope we get it, prior to June 30. And if we have a hard number, if we know it's coming, obviously we'll do accounting to get it into this year. So, but right now, and going forward, I suspect we're going to use, knowing that May is going to be an expensive month for us with that additional payroll, I would suspect of the $288,000 in fund balance that we've budgeted, I expect to use about $100,000 of that this year. And I hope I'm wrong. I hope we don't use any of it. I hope, like last year, we can actually add to the fund balance, but realistically, knowing what we got between here and June 30, I'm saying probably use about $100,000. And I'll be glad to answer any questions.
Just one question. There's been some, I don't know, I don't follow this really closely about what's going on in Raleigh with the Medicaid situation, but there's been some discussion about formulas being calculated incorrectly, and I don't know how that might impact us. Will it impact us, or might it impact us?
I know what you're referring to, and I've read those articles too. I do not think it will affect our Medicaid cost settlement, nor will it affect, or I haven't gotten any word that it would affect the reimbursement rates going forward with Medicaid either. But I will have to say, and Dr. Morrow knows a lot more about this than I do.
I don't think that's going to affect us at all.
Medicaid is pretty much up in the air, or there's a lot going on with Medicaid, but I don't think it'll have an effect on us.
Okay. Is there any other questions or comments? I need a motion to approve physical report.
So moved.
Need a second. too.
Second.
Any further discussions on the physical report? All in favor?
Aye.
Opposed? Motion passed. That covers the old business. As far as new business, 2013 and 14 budget update. John Reed.
You also have another report, fiscal year 2014 budget summary in your package. And I just wanted to kind of go through the changes since we presented the budget to the Board of Health, the changes the county manager has proposed. And if on your report, you'll see the budget that we presented to the Board of Health that we then presented to the Board of Commissioners of $9,183,000. And that funded 119.65 full-time equivalent positions. The manager made two recommendations to change our budget. And the first one is we have a health educator who is a health department employee, just like any other health department employee, only since this employee works with the employee wellness initiative, her salary and fringe benefits were paid out, not out from the health department's funds, but from the county's self-insurance health fund in the past years. So she was still funded by county appropriations, just kind of in another bucket. In past years, the manager wanted to he wanted to move her out of that health fund back to the health department. So that increased our FTEs by one. It increased our salary and fringe benefits by about $62,200, and also our county appropriations. Obviously, we don't have any problem with this because she's always been one of us, and we're happy to wear the cost.
John, I just want to make sure, I think that employee is a nutritionist. not a
I'm sorry,
health educator.
nutritionist, right, nutritionist, sorry. The second recommendation that the manager proposed was, if you recall, we asked for a new position in environmental health, an office assistant position over there. We have one person there now, but the workload is just way too much for that one person. So we asked the county to fund that additional person. That's about a $41,000 cost. The manager, his recommendation was to add that position, but to split the position and the funding between environmental health and the planning department. So that is where you see the reduction of $20,800 coming out of the county appropriations and also out of our personnel line. Dr. Morrow and I met with the Board of Commissioners earlier this week. Dr. Morrow made a pretty convincing case that we really do need a dedicated full-time person to environmental health. So the manager came back today, and we talked to the manager about funding that other half of that position out of our fund balance. I think he's going to propose that to the Board of Commissioners in his final recommendation. So you'll actually see where in our original budget, we had $288,000 of fund balance. We've increased that by $20,823, take us up to about $308,000 to fund the second half of that position. And that's all of the changes as of 4 o'clock today that I know the health department's been subjected to. And all of these three items, I don't think we have any problems with them. They're all, pretty reasonable. And I will say also, when we're talking about the budget, the manager did propose a 2% cost of living raise, which will be the first, salary increase COLA that the county employees have had in probably 4 years. So we're certainly hoping that sticks. So that was, the next step is, I guess, the commissioner workshops will continue, and mid-June, late June, they will formally adopt a budget. I'll be glad, and when we meet in June, I'll bring you back up to date on anything I've learned since then.
Where would that leave us in fund balance for at the end of that fiscal year if we budgeted $308,000?
Because we added to it last fiscal year, that'll leave us, round numbers, about $900,000. About $900,000. Well, $900,000 going,
$900,000 going in, but with
into it.
$300,000, it'll be takes
so
down
it'll be,
about six.
yeah, we'll use more than 30% of that, so $600,000.
That's if you use all 300,000.
Exactly,
Yeah.
exactly. Thanks, sir.
I appreciate it. Any other questions? Thanks for the information, John. Next item on new business, county health ranking.
I'm going to do that from over there, Mr.
Dr. Moore, okay, feel free.
I wanted to take this opportunity to since we have a televised meeting tonight, we have talked about the county health rankings at, I guess, the last couple of our Board of Health meetings. It came out earlier this year, but I wanted to take this opportunity to show the public what this county health rankings is all about. Pitt County was ranked this year. We've been ranked for the national rankings have taken place over the last 3 years. And Pitt County this year ranked 48 out of 100 counties in North Carolina for health outcomes and 40th for health factors. Now, these county health rankings are funded through the Robert Wood Johnson Foundation, and they're a new tool, I'd say, that public health can use to compare ourselves with other counties in our own state. So we can compare Pitt County with any other county in North Carolina. And I wanted to show the public just how to get to this website, because I think there are some really neat things on here that the public may want to access, and because the public really are our partners in terms of improving our status. I've talked to you all a little bit about the meetings I've had with Steve Lawler from Vidant Medical Center and Dr. Paul Cunningham from the School of Medicine. And one of the initiatives that we've been talking about is the possibility of improving Pitt County ranking from where we are today, 40th and 48th, up to 20th by the year 20 as a goal for us to work towards. It's a very challenging goal, I'd say, to do that, and I can talk a little bit more about that. But I think the most I want to get out of this tonight is for the public to see how to access this information at home on the internet at the library, wherever they can access the internet, they can get to this. So when you go to the internet, and I hope the public can see this, you want to search county health rankings, and it'll take you to this site, countyhealthrankings.org. And then this map comes up, you can see, and then it's just simply clicking on North Carolina. And then once you get to North Carolina, it shows you this is the health outcomes ranking, and you see this map is color-coded, with the darker colors being worse and the light white color actually are the best counties in the top 25%. So you can see Pitt is in that second quartile between 26 and 50 out of the 100 counties. It's nice North Carolina actually has 100 counties to work with, isn't it? So we're ranked, as you can see over here on this left side here, Wake County is ranked first for health outcomes. And health outcomes are really your premature death. So deaths before the age of 75, and morbidity. And then health factors, I'll show you those in just a second, have a lot of other things that contribute to morbidity and mortality, or the factors that contribute to that poor health. So you can see we're actually doing pretty good for eastern North Carolina. You can see this dark area through here to the south and to the north of us, some of the poorer counties in the state, as you can imagine. But that's not necessarily true that poor counties rank low, and I think that's really important. In fact, I would turn that around and say that unhealthy counties become poor, and healthy counties prosper. And that, I think, really is what drives us to change where we are. Folks are talking about the economy and jobs today, and our health status is very important in terms of the health of our economy. So if we can improve the health of our community, I think we'll also increase the number of jobs, we'll recruit new businesses here, we'll have healthier employees, we'll have happier employers because their health care cost will go down, and we can, I think, help Pitt County become a better place to be and a better place to attract other people to come here and live and work and prosper. So how do we get there? I think those are the big questions we're going to have to answer. And this tool, if you will, the County Health Rankings, actually have some additional tools that help us get there, figure out how to get there. So let me just show you Pitt County. This is health outcomes. And this is the summary sheet that I think I handed out to you tonight, that shows what makes up health outcomes as being mortality, which is premature death. And you see there when you just put the cursor over it, it tells you that's the years of potential life lost before age 75 per 100,000 population, and that's an age-adjusted rate. And then you can compare that Pitt County's at 7,946. The range is this, with North Carolina being 7,480. So you see the premature death is lower than ours. And the national benchmark is way lower than ours. And then you can also look at this trend here. You click on that and it brings up a chart that shows this actually is going down. This is Pitt County at the top here, going down. The orange is North Carolina. That's also going down. And then the United States is the bottom one, and it's also going down. So we're trending in the right direction there. That's good. So morbidity is made up of these four things: poor or fair health, people reporting that, And the data sources are also available on here, so you can go on and look at where did this data came from. And I have to say, some of this data is not the best data we have. We have some better data because of the way it's done. We have some newer data even on some of these things. But it's pretty good, and the advantage to this is that it lets us compare ourselves to every other county in the state. So you have health outcomes here, which we ranked number 48. And then down here you have health factors, which contribute to that mortality and morbidity. And we ranked 40th out of 100 there. So we did a little bit better in health factors. And let me just scroll down and show folks what makes up the health factors. That includes health behaviors like smoking, obesity, physical inactivity. And again, it gives you those definitions of what that is. Excessive drinking, motor vehicle crashes, sexually transmitted diseases, teen birth rate, clinical care areas. We actually do pretty well, as you can imagine, in the clinical care areas because we have the medical school here and the dental school here and nursing schools, and so we have a lot of clinical resources here compared to much of, particularly the rest of eastern North Carolina. And then social and economic factors like high school graduation, college, unemployment, children in poverty, inadequate social support, children in single-parent households. This is the one that we just heard about last week, and you have some data on that where Greenville Metropolitan Service Area was ranked second in the whole country for the number of children that were born in single-parent households. And we were behind Flagstaff, Arizona as the first. Now that was census data that was taken, and we don't have the breakdowns of the ages of those mothers yet. All we know is that they're between the ages of 15 and 50. So we're trying to get a little bit more information about how that data really got interpreted. But nevertheless, as what the data says right now is that we're second in the country. Now, I do need to clarify that it says Greenville, North Carolina, and all the media came out and said Greenville, but it's not actually just Greenville. The Greenville Metropolitan Service Area includes not only Greenville, the city, but it includes all of Pitt County plus all of Greene County. So that makes up the Metropolitan Service Area for Greenville, and that's what the data reflect. So we need to break that data down into a little bit finer pieces to understand it better for Pitt County at least. Violent crime rate is another social and economic factor. We've heard a lot about violence and crime in the area. And then you have their physical environment, things like air pollution, fine particulate matter, drinking water, access to recreational facilities like parks, limited access to healthy foods. We're talking about fresh fruits and vegetables there. And then last is fast food restaurants, and you can see there Pitt County has 54% of our restaurants are considered fast food restaurants. We've talked about that issue in the past too, how it relates to our obesity problem. But you can see that just comparing to the national benchmark, we're twice what the national benchmark is in terms of density of fast food restaurants. And then you see individual rankings. We're 18th for our physical environment, so we're actually doing better on physical environment. We're 9th on clinical care, which is pretty good. Social and economic factors is a big problem there, as well as health behaviors as a big problem. Now, another thing I just want to show you is this button up here. It's called Areas to Explore. If you click on that button, it actually does some evaluation for you and shows you areas that you need to work on, and those are highlighted. And one of those is our adult smoking rate at 19%. The national benchmark there is 13%, so we're a good bit above that. Adult obesity at 36%, we know that's a problem here. This is a huge one, sexually transmitted infections. We are way, way, way above the national benchmark of 92. More than 10 times what the national benchmark is, and more than twice what North Carolina's rate is. So that's definitely an area we've got to concentrate on. But again, back up to the adult obesity, if you click on this trend, this is something I think that's also concerning. You can see this is from 2004 through 2009, and just since 2008-9, Pitt County adult obesity rate was trending up at a fairly significant, faster rate than the state or national rate was going up. So that, again, is a bad sign, I think, for the health of the people of Pitt County. High school graduation is another area. So not all these things are health-related, and I think that's the thing that also I want to, for the public to understand, is that people tend to think of, what the health department does and what medical care is all about in terms of improving the health of people. But the fact is that medical care only counts for about 10 to 15% of the health status of populations. And the rest of it are these kinds of things. They're how many parks you have, how many children live in poverty, are people employed, do they get a high school education or college education, is there violence in their community. So we've got to pull a lot of partners together to fix Pitt County, to bring us from 48th and 40th down to 20 in the next 7 years. We've got to pull all our partners together. This is not something that the health department can accomplish by itself. We got to work with the sheriff's department, the police departments on the crime issues. We've got to work with the public schools and the universities on the education issues. We've got to work with the Department of Social Services on the poverty issues and some of the child safety issues. We've got to work with the hospital on things like safe areas for injury prevention, for instance. They've been doing a lot of work in that area for years. So we've got to pull all of our partners in Pitt County around these issues. We've got to work with churches and nonprofit organizations as well to do this. I did want to just show you how to compare counties and show the public how to do that. If you click on this button that says Compare Counties, it takes it just a little while to load. And then you add a county to compare, so we want to put in Pitt County in here, and here's Pitt, so we'll add that. And Pitt comes up here with North Carolina next to it. And then we can look at, say, Robeson County is about the same size as Pitt County in terms of population. And you see Robeson County is not doing as well as Pitt in health outcomes. Or we can cancel that and look at, say, Orange County over by Chapel Hill is another one I think that we could compare with, or Durham County. And you see Orange County's doing great in terms of health outcomes. They're number 2 in the whole state. They actually trade places with Wake County. They're number 1 for health factors and number 2 for health outcomes, where Wake is number 1 for health outcomes and number 2 for health factors. So we can do a lot better. I think that this is a great tool. What I just want to invite our public to look at these things, to study them, and to think about how the organizations that they work in, the companies they work for, the churches they pray in, the schools that they attend, how they can improve this ranking through their policies or through other initiatives that they can do themselves or in groups. Pitt Partners for Health is our grassroots initiative that's been here for I think 17 years now, at least 17 years. No, I think it's more than 20 now, isn't it? 18. Okay. Thank you. But these are the kinds of things that Pitt Partners meets every month to talk about and to work on. So if folks are interested in joining Pitt Partners, that's one place that I think some of this activity is going to take place. So I'll stop there, and if you have questions, I'll be glad to try and answer them. Yes, sir, Dr. Oates.
It doesn't seem to address drug use in any way. It talks about smoking and drinking. But, drug abuse, is that a factor? I know it's a factor. Or is it just able to quantify that factor, or do they not even attempt to quantify that factor?
Yeah, they don't. They obviously cannot include everything. And so in terms of the largest issues, by far smoking is the biggest one. It's the number one cause of preventable death and disability that we have. And then drinking, as they define that as binge drinking, was the one they used. So yes, and you're right. Other illegal substance abuse is certainly a factor in a lot of this, and goes in with some of the crime issues I think we have. So we're gonna need to address that, even though the data is not necessarily into this county ranking. Yes, Dr. Aycock?
Looking at your goal down the road, do you think the healthcare initiative or health insurance mandate would play a part in improving people maybe getting access to care where they didn't before?
Yeah, absolutely. And as I said, the clinical care area, we're doing pretty good. We're already, ranked number 9 there because we have so much clinical care available. But I think it will. The other thing that the changes that I see in healthcare, including the Affordable Care Act, it is emphasizing population health more, and it's emphasizing prevention more. So I think even though we've got plenty of supply of physicians, the things that those physicians are doing in terms of encouraging more physical activity, that will help build political support, political will for getting more parks and more sidewalks and more bike lanes and things that'll help this community get more active. So yeah, I think it will impact it, maybe indirectly, and it may take a few years too, but hopefully we can get there by 2020.
Dr. Morrow, do you think it would be reasonable to put a link to this site on our website to make it more easily accessible for the public?
I think that'd be a great idea, yeah. We'll see if we can do that. And they do renew these rankings every year, so we'll continue to see what it is next year and the year after and the year after. And they're improving some of the tools too, so we'll probably get into some of these discussions on some of this, the tools that are in here more in our subsequent meetings. Okay.
Any other questions? Thanks, Dr. Morrow. I agree with you. It's not going to be only the health department, but it's going to be everybody working together in Pitt County to get our ranking of, improve it. Next item on the agenda, Pitt County Partnership.
Yeah, Dr. Lauren Whetstone.
Dr. Lauren Whetstone.
Here to talk a little bit about some of the partnerships I was just mentioning.
I know, that's what I was going to say. You set me up perfectly for that, so perfect
That's
segue. So I want to talk with you all, and thanks for inviting me to come and talk about this. But pull up this. So Dr. Morrow was talking about how to improve our health status and the health rankings of the community, that it really is going to take a partnership among lots of folks to be able to do this. And in Pitt Partners for Health, I'm sort of here representing Pitt Partners for Health today. We worked with Dr. Brandon Noel from North Carolina State University, who did a collaborative partnership mapping project. And the goal, so I'm going to start by saying that I'm going to talk about this, but I wasn't one of the researchers involved in this project, but I'm just representing Pitt Partners, and we wanted to share with you what she shared with us. She really has an interest in understanding how we improve community level outcomes, so the things that Dr. Morrow was just talking about, how do we improve those outcomes through collective approaches? So through working together, how can we make a difference in the health outcomes within a community? So Dr. Noel's goal in this project was to create a map, essentially. So you'll see, I'll show it to you in a little bit, an actual map of the collaborative partnerships in Pitt County and their connections to each other via shared members. So this is a process I'll tell you a little bit about how you look at membership lists from different organizations to understand who is working together. So really the ideas were to, within Pitt County, to look at the partnerships and really to have a sense of what does the landscape look like? How many partnerships are there? How many of them are working together? What kinds of things are they working on? And how can we do a better job of working together? So in what ways are there memberships, as I talked about, are there members that are common to more than one partnership? How many of those have common members? And to look at the strength of those partnerships. So the first step that Dr. Noel took was to survey members of Pitt Partners for Health. And so she sent out, or actually it was via SurveyMonkey, I believe, a survey to 179 members of Pitt Partners for Health. 59 surveys were returned, so gave us a 33% response rate, which doesn't always sound great to say just a third of the people answered, but that's actually a pretty good response rate for surveys. Sometimes if you do like mailed surveys and things, they're as low as 5%, so 33% is pretty good. And in fact, if you look at the people who were considered active members of Pitt Partners, 82% of the active members returned surveys. So she got good data back from the people who were most actively involved in Pitt Partners for Health. Just a little bit about the characteristics of who responded. 15% were African American, 82% Caucasian. More than half had a master's degree or higher. The average length of time as a member of Pitt Partners was around 7 years. So people who had been in the partnership for a while and had enough experience in the partnership to speak well about those and to speak with knowledge about Pitt Partners. And I think one of the interesting things is that next bullet point, that the organizations that these respondents represented had been a part of Pitt Partners for an average of 12 years. So the person themselves may not have been a member for 12 years, but their organization had been a part of Pitt Partners for up to 12 years, or for an average of 12 years. And as Dr. Morrow said, Pitt Partners has been around for about 18 years, so it's a substantial number of organizations that have been very active for a long time. And about 87% of the people who answered the survey said that they gave about 1 to 5 hours to Pitt Partners every month, in addition to attending the regular meetings. So they're folks who were pretty actively involved in the partnership. They answered questions, the first group of questions around satisfaction with the partnership. So how satisfied are people with Pitt Partners? They used a 5-point scale from not at all satisfied to entirely satisfied. And you can see by looking at that far right column that almost 3/4 of the respondents were somewhat or very satisfied or entirely satisfied with their personal experiences as a partnership member, the planning process that the partnership is using, the progress that the partnership has made toward reaching its goals, their performance in organizing different public health interest groups toward a common vision. So really having a common vision for Pitt County and then working to bring people together to reach that vision. And so overall, over 75% felt that they were satisfied or very satisfied with the overall partnership functioning. They were also asked about their perspectives on Pitt Partners for Health, and you can see that the responses to this, and when you look at them, it looks like maybe some of those columns may not be as positive, but these are questions that are flipped around, so look at those in that way. 95% said that they agreed that improving coordination, so again, this sort of partnership among different agencies, improving coordination among the members of Pitt Partners is critical to improving public health in our community. So having coordination among efforts among members of Pitt Partners and their other agencies is critical for improving public health in our community. Most of them disagreed that the consequences of not working together are minor. So in fact, they're saying if we don't work together, there are major consequences for not working together on improving the health of our community. Most, over 90%, said that they couldn't overemphasize how important it was to work together, and that about 83%, and I'll flip that around, 83% are saying that their organization's goals are closely related to the work of Pitt Partners. So most of these agencies where folks were working in organizations had visions and missions that were close to what Pitt Partners is. And then finally, just real quickly, they asked folks to talk about how they supported Pitt Partners, and you can see that the most common ways that organizations and agencies and folks in those agencies support Pitt Partners is through endorsing and adopting the mission of Pitt Partners, carrying out activities in the name of Pitt Partners, endorsing and co-sponsoring coalition or partnership activities, and then also through providing meeting space, food, and things like that for meetings. So let's move on to the partnership networking part of it. So the second step in all of this, so it was first to talk to the members of Pitt Partners. One of the things that was in the survey was asking the partnership members to talk about what organizations they're involved in and what other network or what other partnerships they might be involved in. So from the survey, Dr. Noel identified other partnerships in the county. So what are the other partnerships that are out there that are addressing health and wellness? And you can see that she uses as a definition 3 or more organizations or agencies who meet regularly together to improve the health and wellness in Pitt County. So she conducted interviews with the leaders of these partnerships. So the partnerships were identified through the survey. Dr. Noel conducted interviews with those leaders and asked them, what are some other partnerships that exist? And then she would go and interview those leaders. And she basically reproduced that process until there were no more new partnerships named. So it's sort of a snowball processing. So who's another partnership? Get the name of that leader, interview that leader, where are some more partnerships, and kept going until she didn't get the names of any new partnerships. So this third step that Dr. Noel undertook was to do what's called a social network analysis. And that's what results in the map I'm going to show you in a minute, which is sort of showing the connections of all of the organizations and partnerships in Pitt County. So again, it's a study of social relationships among what's called a set of actors, which are the people who are engaged in this kind of health and wellness work. Again, I said she did interviews with the 14 partnerships and created member lists. So from each of those agencies, she asked them for a list of all their members. And then they put together an integrated database that lists every member of every partnership and then looks for overlaps. So looks to see how much shared membership there is among those partnerships. So what are the reasons for getting these kind of data? What can they tell us? One of the main things is that they give us sort of a system level perspective on Pitt County. So how are our systems? What are they functioning? How are they functioning? How are they working together? Who's active, specifically people? What people are active? What organizations are active? What partnerships are most closely linked together? And which ones aren't linked together? And that can be important information too. So who's not working together, who really could benefit from working together? It's useful in identifying new partners. So if you have this map and you're in an agency or in a partnership and you want to do a specific kind of work, you can look at something like this map and say, hey, there's an agency that's already doing that. There's a partnership who's already addressing this issue. There's no need to reinvent the wheel, avoid this redundancy. So we don't need to start over again when there are agencies and organizations that are already doing this. Help us look for synergy, help us look for gaps. Who's not working together? So I'm going to show you the map in a minute, and I'm going to say when I show it to you, one of the things that I can't stand when people say when you go to a presentation, that is, you're probably not going to be able to see it because it's a lot of agencies and a lot of organizations. And I hope you guys got copies, and if you didn't, I think they'll get out there, or you should have copies at some point. So if you don't have one now, then we'll make sure that you get one. But when you look at the map that I'm going to show you, you can at least get a picture by seeing that the blue squares are going to represent partnerships. The red circles are going to be individual organizations. The closer the partnerships are located on the map, the more members are overlapping. The further away they are, the fewer members they have that they're sharing. And the organizations that are in the middle of the map are those that span across multiple partnerships. So let's look at the map. So again, like I said, you're not going to be able to tell who these organizations are. But you can see that there are a lot of organizations in this county that are addressing health and wellness in our community. And Dr. Morrow talked about that we need for us all of these organizations to work together to improve the health status of Pitt County. So look again at the blue circles again are partnerships. There are 14 partnerships. The red circles are different organizations. So there are things like, just because I know you can't see them, there are things like, let me find one. So the Food Bank, the Pitt Resource Connection, Port, DHHS, Spring Arbor, the Real Crisis Center. Those are the kinds of places that are listed in those organizations. And again, if you look at the ones that are closest to the blue boxes with just little lines there, those are the ones that have the most shared memberships. The ones that have a line that's further from the blue box are the ones where there are fewer shared memberships across those. And that same thing goes across organizations also. So what Dr. Noel found is that, as I said, there are 14 distinct partnerships that focus on improving health and wellness in Pitt County. There are 163 different organizations represented as active members of those partnerships. So from those partnerships, there were 163 organizations that contributed members to those partnerships. And about 75 of the organizations, of those 163, had members that were on more than one organization, or more than one partnership, sorry. So we could see that there are folks who are active and not just in one place. So they're not just active in one partnership, but in fact are usually 75 of them active in more than one partnership. So we can see the importance of sharing information, and I'm going to talk about that in just a second. So the partnerships with the strongest connections to the most other partnerships via shared membership were the Pitt Aging Coalition, the End of Life Coalition, Safe Communities, the Pitt Resource Connection, and Pitt Partners for Health. So they had the most shared membership. The ones with the organizations that bridged the most partnerships, so these organizations, Brody School of Medicine, the Health Department, Vidant, and East Carolina in general, bridged across the greatest number of partnerships. So among those 14 partnerships, these 4 organizations bridged across those 14 partnerships. And for the purposes of Pitt Partners, and I'll just go over this real briefly because Dr. Noel made this presentation to the steering committee of Pitt Partners and wanted to show us where we had the greatest membership overlap. So if we see Pitt Partners as sort of the grassroots organization that's leading efforts around sort of community health, who were the agencies that were most connected to Pitt Partners? And those were the Pitt Aging Coalition, the End of Life Coalition, and the Pitt Resource Connection. The ones where there was the weakest connections were the Pitt Senior County Senior Games, the Pitt County Safe Kids, the local physical activity and nutrition group, and the Pitt County Substance Abuse Coalition. And one thing I'm going to mention in just a minute is that a weak connection is not necessarily a bad thing. So let me tell you about that in a second. So some food for thought that Dr. Noel brought to us. One of the things she said is that there is a different way of looking at both strong and weak connections. So strong connections mean that there's a lot of overlapping membership, and that should really help with the flow of information. So if there's a lot of overlapping membership, then there's a lot of information being shared among a lot of people. But it can also, if the same people are on all of those organizations, all of those partnerships, can lead to sort of entrenched thinking. So the same people thinking the same things in the same groups, where does the novelty, how do we come up with new ideas? How do we come up with innovative ways of looking at health improvement? So one of the things she challenged us to do was to think about where Pitt County is in this balance. Do we have a good balance between shared membership, which is good for sharing information, and not too much of we're getting stuck in this sort of entrenched way of thinking. So that was one of the things she challenged us to think about. The other is to think about what she called the strength of weak ties. So weak ties can be valuable because they can connect us, even if it's through one person, connect us to a new way of thinking, to a person we may not have thought about, or a partnership that we may not have thought about the way that it can help us in some of our health improvement initiatives. So one of the things to think about is, does Pitt County have the ability to coordinate across these different interest areas? Do we have people that can help us coordinate these different groups together? Are these weak ties productive? Are they helping us? Because they could be counterproductive. They may be so distant that they're hard to bridge those gaps. So we have to think about, how do we bring even those weak connections, how do we make those productive connections? And sometimes that might just be one person who's sharing information, and that might be enough. She was telling us that sometimes one person is enough as long as you're sharing the information and thinking of those new ways of thinking about community health improvement. One thing I'm going to finish up real quick because I know you guys have something else to do. One thing she did was did this same process in 2 other counties. And so I just wanted to point out that she did comparisons between Pitt County, Durham County, and Forsyth County. And you can see that in terms of population, Pitt County was the smallest population of the 3 she did, but the largest in terms of geographic area, and with 25% of residents living below poverty level compared to Durham and Forsyth counties. We didn't have the most number of partnerships. Durham had the most at 34 partnerships. But if you look at the things that are most important to me are looking at those last 2 bullets. And that is, look at the age of the partnerships, the average age of the networks in Pitt County. 15 years is the average age of the networks and partnerships that exist in Pitt County right now, compared to 9 in Durham County and 12 in Forsyth County. So it really speaks well to the kinds of partnerships that we've formed in our county, that they're long-lasting, enduring partnerships that are doing good work. And finally, that last bullet point, which is telling us that there's an average of 92% linkage among those partnerships in Pitt County, compared to 64% in Durham and 79% in Forsyth County. So our partnerships are linked together well also and working together. So I think it's important, and we should pat ourselves on the back, I think, in looking at the kinds of partnerships we have in Pitt County and the work that they're doing together. So I'm going to end with this sort of graphic telling us, are we being strategic in developing and managing our networks? I think it's an important thing to think about in light of what Dr. Morrow was just talking about. We want to try to improve and move up in the health rankings to be 20th and by 2020. We can take advantage of these partnerships and really be strategic in thinking about how to work with these partnerships to make a difference for county health improvement. So I'm going to stop there. And I'll answer any questions if anyone has any.
Anybody have any questions?
Great, thank you.
Well, thank you, Dr. Westone. It was interesting seeing all the partnerships linked together.
If I could just take a minute, Mr. Chairman.
Absolutely, go ahead.
Lauren, I want to thank you personally for doing this tonight, but even further, I really want to thank you for your efforts here in Pitt County. Lauren and her family are moving to California pretty soon. Lauren is an employee of East Carolina University, and she has been a steady partner with Pitt Partners for Health, has volunteered her time in so many ways. It's been a great companion for us in public health in terms of helping us get things done. Her work in epidemiology is doing evaluations for us on projects has been invaluable. She has really shown some great leadership in the community and just professionally, and in the community also. Just she and her family, I think, have done some great things volunteer-wise. She's very physically active. Family does a lot of paddling, I think, and biking and everything else. So she has helped organize things in Pitt County in a short number of years she's been here. I think she and her family have added a lot to this community, and we certainly miss all of them. Thank you, Lauren.
Okay, next item on the agenda is Health Director's report.
And I'll make this as brief as possible.
No, that's okay.
I did just want to update y'all on a few things. We mentioned some of the activities that are going on in Raleigh this week. A lot of legislative issues are coming up. Thursday is the deadline crossover day, so I think we'll have a better idea at the end of this week what we have to face. But some of the issues that public health directors have been dealing with this week include House Bill 703, which is a bill that would preempt, again, local boards of health and local county commissioners' abilities to pass rules and regulations dealing with smoking in public areas. This would take us back to where we were before 2010 in terms of tying the hands of local boards of health to deal with smoking issues. So we're certainly trying to fight that bill. And I think there's even a larger concern in terms of just preempting the authority of county commissioners to do any kind of local rules and regulations. So we hope we'll have support from the County Commissioners Association against that bill. Another one that I was in Raleigh with last week is dealing with, it's House Bill 693, and that's dealing with the minor's consent. There is a law in place, has been since 1977, that allow minors to consent for prevention and treatment of pregnancy, sexually transmitted diseases, communicable diseases, and mental health and substance abuse issues. That law was put into place back in 1977 because we had a problem with children who unfortunately did not have good parents. And so that law was put into place for these children, some of these children that have actually abusive parents. Sometimes the parent is the one who has prostituted the child or even incestuously infected the child with a sexually transmitted disease, and the children were not able to get treatment without parental consent. And so that law was put into place to protect these few children. So I think our message to our legislators, there would take away that exemption for children. They would be required to have parental consent for all of these things. And they could get that consent either through going to a notary with their parent. They could be notarized, but that's a lot of trouble, as you know. Children don't know how to access that kind of thing. The other option this bill gives them is to go to the courts, to petition the courts, but anyone who's been in the courtroom lately knows you don't just get in there and get back out in a timely fashion. So when we're dealing with transmission of communicable diseases, any time that we delay that treatment and diagnosis is time that's likely to spread that communicable disease throughout the community. So we're very concerned about this House Bill 693. As I told folks in Raleigh last week, this bill was not put in place for my children or your children. This is really in place for those few children, there are not many, that don't have good parents or even homeless or runaways. And until we deal with that problem and correct that problem, I think the current law needs to stay in place. Our public health nurses always try to involve parents in any type of decision around their health. And I think we do a very good job of doing that. I'm sure there have been mistakes made in the past. I don't doubt that at all, where a parent who should have been involved wasn't. But overall, for the last 35, 40 years this law has been in place, I think we've done a great job of getting more children back in communication with their parents about these health issues. But passing this legislation today, I think, really throws up a roadblock and would turn needy children away from our door without any help. And that's certainly not what we want to do, I think.
Was back in the change.
The bill is sponsored by Representative Whitmire. I believe he's from Transylvania County. And I can't remember who the other co-sponsor was right now.
Was there a group that was pushing for this change?
There is. It's about parental rights is what they're trying to get at, which, I certainly consent. I mean, I've got 4 girls myself, and like I said, we want parents involved. And we try very hard to get parents involved in those decisions. So I don't think this bill in its current form really does what they want it to do. But as they say, legislation's not necessarily pretty all the time. And so I think hopefully we worked on working on an amendment to exclude local health departments from the bill at least. It still would affect private doctors' offices, and I think it's bad. It's bad for public health for this to pass, I think. So we'll keep our fingers crossed, and we should know more by next week in terms of that. Medicaid reform is still a huge issue for us, as we talked about earlier. John Reed showed you, we are very dependent on Medicaid revenues, as are other health departments in the state. We've had a great partnership with Medicaid for a long time, but the current plan to potentially privatize part of Medicaid, I think would doom a lot of particularly smaller public health departments in the state. So we're very interested in making sure that the plan for Medicaid reform does not harm public health. The Secretary of Health and Human Services, Dr. Vosh, and the Medicaid Director, Carol Steckel, are scheduled to be in Greenville this Thursday over at the medical school, and I plan to attend a meeting and speak to them there about that issue some more. But we think we've got a great system in North Carolina. Other states that have privatized Medicaid are now trying to get to where North Carolina is in terms of using a community care network model that we've had in place for more than 10 years now. So I hope that we can get there. And that's all I have, Mr. Chairman.
Any further comments? Or
I'd just like to make a acknowledgement that Dr. Morrow was the commencement speaker for the Brody School of Medicine's Department of Public Health, the graduation ceremonies on Friday, and which is a great honor for him, and I think for us to have our health director be the commencement speaker. And he did a very fine job. He sort of divided up his comments, first part, to educate the parents and the families and friends who were there for their friends or loved ones' graduation. And in the second part, he challenged the new graduates to use their degrees and talents wisely to improve the public health. So I just wanted to mention that Dr. Martin did a very fine job.
it's nice to know. I didn't know that. Congratulations. I need a motion to adjourn. A second, yeah. All in favor to adjourn the meeting? Opposed, no. Meeting's adjourned.